my experience in healthcare, which is about 40 years of experience as an independent practitioner, and also as someone who's worked within healthcare systems. So I'm here just to talk a little bit about profits in the healthcare system.
Okay,
where the money goes.
My first question was tell folks why you're here, so I think we got that. So Doctor, talk about how for-profit health insurers get between you and your patients.
I've been in practice a long time. I went into practice after training. I went into practice in 1972. At that time, 70s, 80s, probably about 10 to 15% of the money that went into healthcare went to middlemen, whether they were insurers or whether they were administrators. There's a lot of money that goes into healthcare. And really, if you look at the people that are in the healthcare system, the people that belong in the healthcare system, there's really two people, there's the consumer and the provider. We're all the consumers. I happen to be a provider. Nurse practitioners are a provider, healthcare providers, people that make medicines, there's hospitals, consumer provider. There's someone that has to get the two together and administer, and that sort of makes sense. And whoever administers should make a fair profit. There's nothing wrong with making a fair profit. I'm not sure what kind of business you guys are in, but fair profit, that's fair profit for your work. Well, right now, today, 2011, 45%, literally 45% of the healthcare dollar off the top goes to middlemen, goes to the insurer. And every single insurance company that you look at Blue Cross, Blue Shield, Aetna, Cigna, all of the insurance companies, they're all publicly held for-profit companies.
That are traded on Wall Street.
Yeah, they're traded on Wall Street. Business is business. So who's really making money off of this system? Physicians are paid. So really,
literally, 45 cents, almost half of our healthcare dollars goes.
So if you want to take a look, why is healthcare more expensive? Are physicians being paid more? No. Most physicians are being paid less now than they were 10, 20 years ago. Forget the cost of living. Oh, okay, so the people that are paying into the system, what's happening with that? Are they getting more? No, we're getting less, we're paying more. So where is this money going? The money is going to that middleman, that administrator, who is now no longer an administrator. Now is big companies, big corporate profits behind it. For example, HealthNet. Let's take a look at HealthNet, which is a publicly held company. 3 years ago, HealthNet made about $125 million profit. Okay, fine. That's just distributed to their shareholders.
Right.
But, if you take a look at healthcare stocks over time, healthcare stocks are a great way to invest. You got bugs going to healthcare. So, where is this money going? So, HealthNet made $125 million. The year after that, they only made $95 million 2 years ago. Why was that? You know why?
Healthcare reform, possibly?
Disenrollment.
Disenrollment.
As we all lost jobs, we lost health insurance.
Oh, got it.
So there was less bodies, there was less insured bodies. The system looks at insured bodies. They don't look at you as Richard. I forgot your name.
David.
You did tell me. I shouldn't forget that because two of my children's middle name is David. Okay. So you lost bodies.
Right.
Okay, but instead of saying, hey, we're all suffering in the economy, we're going to scale back and say, no, how are we going to make more money? So what HealthNet did, and a lot of insurers, is it changed their formularies. Drugs that they used to pay for, so instead of, okay, you need Lyrica for your connective tissue disorder and for your feeling of pins and needles. Lyrica is a good drug, fine. You pay your $20 copay, we pay the rest. All of a sudden, no, sorry, we're not covering that anymore, except for this, and this.
So they changed the rules in the middle of the game.
I've seen that in my patients. I'd like them to get certain medications. No, they won't cover it anymore. So then what I have to do is I have to spend about 15, 20 minutes of my time filling out forms to say, okay, why this didn't work, this didn't work, this didn't work. And doctors don't have time to do that anymore.
Right.
Not in the healthcare chains. You also take a look at the different systems. Kaiser, Sutter, Mercy, non-profit, right? Right, they're all non-profit. Yeah. But take a look at the Sacramento Bee. Take a look at all the big billboards. Huge. You think that
they spend a lot of money on marketing?
Huge amount to get people within their system that then runs and pays a whole lot of executives and middle people that really don't even need to be there.
So anyway, health insurance is expensive. You're doing fine. Health insurance is basically as expensive in America, in your view, not because doctors are making a ton of money or getting paid a lot more than they were, but because
most doctors,
general practitioners, primary care doctors
are not making
have actually gone backwards. If
you take a look at their per hour salary, it's not much different than plumbers and mid-level attorneys.
And you're spending increasing amounts of your time being basically a billing agent for an insurance corporation instead of being a doctor.
A lot of paperwork. The whole idea of medicine, if you're going to make profit off of medicine, you don't want to have people healthy. To have people healthy means they don't come in as much. It takes me longer, much longer, to work with the patient. For her, I happen to be a gynecologist. To work with the patient, I specialize in menopausal medicine and sexual medicine.
Okay.
So for me to work with someone who has fatigue, who has sexual issues and so forth, that's a lot of work. I have to understand them.
Right.
A couple has to understand each other. Maybe they need a certain kind of therapy. They need to learn how to eat. They need to learn about exercise. It takes a long time. Much easier is I prescribe a pill. Boom, boom, I'm done.
Right.
They're the heck out of there. They're out of there. Well, that makes money for the system because I can see more patients, more co-pays. They can buy more medicines, and onward it goes. So, but you have to look at it from the other viewpoint also. I mean, it's not unfair that people make a profit. If an insurance system is helping to get the consumer together with the doctor and being a middleman, they deserve to make a fair profit. And they were. But now things have changed. Who's making a profit off medicine?
So the key word there is
the
fair.
Stockholders.
The key word there is fair.
It's fair. And it also has to do with who pays for what. And the interesting thing, you're a voter. You're a voter. I'm a voter. A lot of voters are on. In California, in the past 10 years, on the ballot have been 2 measures for single-payer health care. That would get rid of the insurers. Okay? In Oregon, about 7 years ago, there was a wonderfully thought-out measure for single-payer health care. It was voted down by 70% to 30% in Oregon. A little closer in California, but still, the voters have said, no, we don't want single-payer. We want the insurance companies to make all this money. So,
we got some work to do.
We got a lot of work to do. And why is this? Okay, many people might have actually read the measure to say, okay, where is this money going to go? Very few people did. What people did is they heard the 30-second commercials that flooded the television in the week before the election. Oh my God, oh my God, oh my God.
Bought and paid for by corporate dollars.
15 million, 11 million in Oregon, 15 million the last time.
Got it.
Here. That's a lot of money.
Okay.
Dr.
Goodman, wrap it up. Give us a parting shot, my friend.
Well, take care of yourself. Take care of each other. Be healthy and vote and vote and vote. When you see something for single-payer health care, vote. Vote. Don't let people mislead you. Bush got elected because he started a war. He started a war to get reelected. See through this crap.
Right.
See through this crap. Do the work for yourself.
Vote your own interests. Thank you very much, Dr. Goodman.